All right. So this topic we did maybe 2 cycles ago. So it's been a while, but it's come up again because it's still an ongoing issue for many of our patients. So I'm going to talk about vaping and e-cigarettes in our MAT patients. You'll recognize our global learning objectives. And what I'd like to accomplish today is to talk about some of the definitions, some of the lingo, and look at the epidemiology, particularly in MAT patients. We'll take a little bit of a look at vaping-associated injury and death, and then we'll kind of hopefully get into a discussion about, is this the latest gateway drug, or for our patients, is it actually going to be like the newest smoking cessation agent, or who knows, maybe a little bit of both. So let's start out by talking about what is an e-cigarette. So there are at least 3 generations of e-cigarettes already, but in a nutshell, it has to be a battery-powered device that delivers a nicotine-containing aerosol. It does have 3 parts: the battery, the atomizer, also known as the heating element, and some sort of e-liquid. And this will become a little bit more important later, but you either have a solution of VG, vegetable glycerin, or PG, propylene glycol, and that is what contains your nicotine and or your flavorants. And a lot of this info I got from the ASAM book, the most recent edition, chapter 20. So in your first generation, those are called the cig alikes because they look just like a cigarette, and they have a particular charge of 75 to 150 milliamp hours, which basically shows you how much total charge the battery has. And then it's got cartridges and the atomizer. The first generation ones are disposable and rechargeable, and it's activated when you actually puff on it. The second generation ones look like they have a tank on them. It's like a clear, looks like a clear glass or clear plastic tank, and it's refillable, and it's actually got a manual switch. Then the third generation one is called an advanced personal vaporizer, or an APV, and it has multiple shapes. It's got a lot of charge in the battery, and it is something that has a mechanical mod or a regulated mod, and I'll tell you what those terms mean in a second. And it's got a little button that turns it on, and it is compatible with most tanks. So here's what I mean by the different generations. So first generation does look almost identical to a cigarette. The second generation is a vape pen. Actually looks like a pen. Third generation has that clear tank. And then the fourth generation is very modifiable. Those are the really fancy ones. So this is some of the evolution of e-cigarettes. And so, yes, I have seen my patients with all of these kinds at various times or another. They love to bring them into the office and use them right when they're like sitting in front of me. Well, this was pre-COVID days, of course. So what do our patients mean when they say vape mod and pod mod? So a vape mod, is the one with the refillable tank, and it has customizable coils. And you use this if you are a e-cigarette enthusiast. And if you are an e-cigarette enthusiast, you also have nicknames such as Cloud Chaser or Trickster. These are people that like to tinker, and they want to mess around with the performance of their vaporizer by doing certain things. So that's the vape mod. But if you have a pod mod, that's basically a closed system, and you have these disposable pods. That's where they keep the juice. And the people that use these, or the one that is popular with people, they just want something that's simple and easy to use, almost as simple, say, as a cigarette. So a lot of former smokers will sort of get into this. So that's a little bit of the lingo. You've probably heard of juuling. I remember the first time I heard of juuling was from my then 16-year-old daughter. And I was like, oh, your friends Juul kind of thing? Like, yeah, I've got a couple of friends that Juul. Yeah, right. So the one there that you see on the left is the brand name is actually a Juul. But as you can see, they have all different kinds of shapes, but generally look the same. So My Blue, the Mark 10 Elite, the Miley, the Fix, the Ruby, all kinds of different names, but Juul is kind of what took the market by storm. And what happened was they started showing up in a lot of high schools, and because you charge them through a USB port, the teachers had no idea what they were. They thought that it was like a what do you call it? One of those jump drives, and it was sticking in the side of the kids' computers, and they had no idea that they were recharging their little smoking devices. And so that's kind of how I started hearing about it, was kids at high school had them. So what is in a Juul pod? So that little, clear thing at the top is like a little tank. So they estimate that 1 to 2 packs of cigarettes, or somewhere between 20 and 40 cigarettes, are equal to 1 Juul pod. So now when we ask our patients, are you vaping or are you smoking? I just try to get a sense of how many pods they're using, or I might ask them to tell me, if they've got one of the ones with the tanks, they might tell me the percentage of nicotine that's in their juice. And then it's really hard to do the math now. I mean, when we had packs of cigarettes, it was so much easier. I can do that math very fast. So the math with the Juul pods and, all these tanks and things, very difficult now these days. So many of you may remember, keeping with our musical theme for the Echo, remember the song Smoking in the Boys' Room? And so now I think this is something that maybe the modern day 2020 or 2021 version is, juuling in the girls' room. So this is something that is very much under the radar. And what you can see is that these little prepackaged pods, they come in nice flavors like mango and creme brulee. And it's easy to hide if you're a teenager. And so if you look at trends between 2011 and 2017, this is the percentage of high schoolers who in the past month have smoked. That's the gray. So 16% of teens were, or high schoolers were smoking in 2011, and it went down to 2% in 2017. And then I'm doing this wrong. 16% of people smoked, and 2% of people were vaping in 2011. And then in 2017, the number of smokers had gone down to 8%, but the number of vapors had gone up to 12%. So that's some of the data that comes from the latest surveys. And this is coming from the prestigious Time magazine. But it's got a nice picture. So, all right. So that's a little bit about the epidemiology. How does this thing actually work? So free-base nicotine is treated with benzoic acid, which then creates a nicotine salt. And that's what it kind of looks like in terms of chemistry. What does that all mean? Well, what's interesting is that Philip Morris, if you'll remember that old company, versus Pax Labs, which invented the Juul, is what happened is they kind of did the opposite thing. So Philip Morris stripped away the naturally occurring nicotine salts in the leaf tobacco with ammonia, and they created the free-base nicotine. And so in 2015, the Juul did the exact opposite. They took the free-base nicotine, added benzoic acid to create the nicotine salt e-juice. What does all this mean? Well, when you use benzoic acid, that decreases the alkalinity of the free-base nicotine, which actually allows manufacturers to increase nicotine levels in nicotine salts. Okay, so that's one thing. So you can get higher concentrations. The other thing that we know is that benzoic acid nicotine salts actually cross the blood-brain barrier faster than free-base nicotine, which I'm not a smoker, but if you're a smoker, that's supposed to give you a smoother throat hit. The other thing is that the nicotine salt e-juice can actually be vaped at a lower temperature. So now you need a smaller battery and you can have a cheaper device, a less powerful device, and those can get back in the game again. So you don't need as much battery charge. So it's, to me, fascinating that, Philip Morris did the chemistry one way And then PACS went total opposite and said, all right, let's go back to the other way. So all this tinkering around in chemistry labs, gotta love it. The other thing is that the nicotine salt e-juice, which is what you're getting in your vapes, it's actually more similar to a combustible cigarette. So there are some e-liquids that still use freebase nicotine, but what you can see is you're not getting a whole lot of blood nicotine levels. That's the light blue line. But if you have the e-liquid that's in the form of a nicotine salt, now you're looking at the purple line, which looks a lot more like, you know, burning a cigarette. So you're getting more blood nicotine when you have the salt versus the freebase in the liquid form. So it's a little bit of the science. Another couple terms that you might be familiar with, or you might hear from teenagers and adults, is you might hear the terms dripping and dabbing. But what is that? I guess in some cases, dabbing is like a dance, and dripping is what a faucet does. But when we're talking about nicotine, dripping nicotine means that the adolescent modifies their e-cigarette, and what they do is they take the liquid and put it directly onto the coil. So that's not the way you're supposed to use it. They put it directly onto the coil to increase the nicotine hit. And when they have surveyed teenagers, a quarter of them have already done this, and so they already know what it is. So a quarter of adolescents have engaged in dripping, and the manufacturers are responding to this by making their coils more accessible so that you can actually do this practice. Now, dabbing is a little more, I guess, sophisticated. So dabbing is what's done with THC. So remember, this is an e-cigarette, and it was, you know, originally used, you know, for you to be able to use nicotine. But then what they do is they have these specific rigs. I mean, this one's quite a complicated rig. So the dab rig is the water-filled device through which the user is inhaling the vapor, and then what is attached to the dab rig is like a nail without the head on it. It's like a domeless nail, and the domeless nail is heated with a blowtorch. So this little black thing here is like your little mini blowtorch. It's heated with the blowtorch until it's red hot. Then you wait 20 to 40 seconds. Then you touch a piece of this marijuana wax to the nail, which then produces the vapor that's inhaled through the rig. So I don't know, pretty fancy stuff if you ask me. So I would not know what this stuff was had I not looked it up on the internet. Yeah. Okay, so what does this have to do with our MAT patients? They've actually studied this. So back in 2015, they looked at people who were opioid dependent. 164 of them were on methadone, 151 of them were on buprenorphine. They were all treated in a health system in Massachusetts. The sample was 50% male, so that's a pretty good female population, and 85% non-Latino white. Overall, the vast majority, almost every single person had heard of an e-cigarette. 3/4 of them had tried e-cigarettes, and a third of them were users, like regular users, used e-cigarettes in the past 30 days. So our patients are not immune to this phenomenon. The reasons that people used e-cigarettes, this was again 6 years ago, was curiosity mostly, and to try to get off of nicotine. So 26% of people actually tried it to try to quit. And then the other thing that they found is that the proportion of opioid dependent smokers that had ever tried e-cigs was substantially greater than what was in the general population. Again, that doesn't surprise me very much. Our patients are used to trying, you know, whatever they can to get different things into their system. So, all right, there was another study that was done by Baldessari and colleagues in 2019. This was also East Coast, Connecticut. They looked at about 800 patients that were trying to get into the MAT program. 6% of those folks were daily e-cigarette users. Almost 20% were e-cigarette users in the past month, and 62% reported ever smoking an e-cigarette. And then, of course, not surprisingly, we know this, 85% of the people seeking MAT actually were also cigarette smokers, and about half reported trying an e-cigarette to either quit or to try to cut down on their smoking. Being a daily e-cigarette user was actually associated with higher odds of being a former smoker. E-cigarette use in the past 30 days was also associated with the following things: higher odds of being non-Caucasian, higher odds of having a history of chronic pain, and higher odds of reporting psychiatric distress. And so one of the things that this article speculated on was that some of the interventions using e-cigarettes might actually be effective to help reduce harms and mortality of smoking in patients with opioid use disorders. So that's a totally different way of looking at the whole issue. All right, let's turn for a moment to vaping-associated injury and death. So a long time ago, before COVID, we were actually super scared and excited by people that were dying of vaping. So this seems to me like 10 years ago, and it was like a year and a half ago, okay? Now you don't hear anything about it at all because everything's all COVID all the time. But back in September of 2019, there were 7 people that died of vaping-related illness. So it was like California, Kansas, Illinois, Indiana, all these different states. There's a couple of deaths sort of scattered around the country. And then the CDC got, into all this, and they said, hey, there's about 400 cases of lung illness that were associated with e-cigarettes in 36 states and the Virgin Islands. Okay, so they're like, wow, what's going on here? So then they had to define, as the CDC likes to do, just like the CDC defines, what it is to have a coronavirus case, the CDC also had to define what it is to have a confirmed case of vaping associated lung injury. So the definition was that you had to use an e-cigarette or you had to dab sometime in the 90 days before you got sick. You had to see a particular kind of ground glass opacity on your chest CT or a certain kind of look on your chest x-ray. You had to have the absence of a pulmonary infection on the initial workup. And then you had to have sort of all other testing was negative. So you got tested for a million things that could cause an infection. That was all negative. And there was no evidence in your medical record of any other plausible diagnosis, like you have cancer, you've got heart problems, you've got some sort of weird like lupus or something else going on. Okay, nothing. And then so if you had all these things were true, then they'd say, oh yeah, that's a confirmed case. And then they also defined, as this was all happening sort of live, that there was probable cases, right? So in a probable case, the team, the doctors and the nurses taking care of the patient, they did find an infection, but the clinical team believed that this wasn't the only cause of what was going on with the patient. So you had your confirmed cases and you had your probable cases. Okay, fair enough. And then it got to the point where they actually like named it, came up with a clever mnemonic. I think this one is pretty good. It's called vaping associated pulmonary injury. You like that? So then they came up with this profile that the people that were involved with VAPI or VAPI or whatever you want to call it were young folks, 20 years old, mostly male. 80% of them were vaping with marijuana. So not vaping nicotine juice, but actually vaping with marijuana. And 94% of them reported vaping within the last week prior to them getting sick. The onset is usually subacute, where the median number of days before you got really sick was about 6 days. So it wasn't like you got right away sick within a day, but it took about 6 days on a median for it to sort of show itself. And then what happened was most doctors, again, sort of thought, oh yeah, this is just a mild pneumonia. They got discharged home with an oral antibiotic, only to come back and say, man, I'm a lot sicker, I'm not getting better. So Layden and colleagues talked about the presenting symptoms. 98% have respiratory symptoms, 81% have GI symptoms. So this is like nausea, vomiting, diarrhea. 100% of people had some sort of constitutional symptom, including fever, chills, weight loss, and fatigue. Interesting. 40% had a headache. And then there were, and then they pointed out that having upper respiratory symptoms like your nose running, sneezing, congestion did not seem to be a component of the illness, right? Just a few months later, all these cases of vaping would suddenly be like, oh my God, I think they've got COVID, right? The fever, the shortness of breath, everything. So lots of overlapping things. So, again, the CDC was kind of like hot on the case. What is causing vaping? So what they finally came to is that most cases probably represent a form of lipoid pneumonia, which is like a pneumonia caused by fat, and it was possibly related to the vaping of cannabis oils. So you got that oils that you're taking into your lungs, and then that irritates your lungs and causes like a fat caused pneumonia. And so they did also think that other people could have something called cryptogenic organizing pneumonia. And then as they tried to get further into what the cause was, they implicated vitamin E because vitamin E is a liquid carrier of THC in some forms of vape. And so at least at the time, again, pre-COVID, before that over our consciousness, vitamin E was currently sort of thought to be the most likely culprit chemical for that type of injury. So lipoid pneumonia caused by the vitamin E carrier of the THC. So let's come full circle and, love to hear everybody's opinions and their experiences with their patients about, e-cigarettes. Are they good? Are they evil? Are they neither? Is this sort of the next gateway drug and the thing that's going to entice children and adolescents to get addicted to nicotine and start smoking cigarettes and start doing other things? Or in our MAT patients, is this going to be the new way that will get patients actually off of cigarettes? So we'll get them off of one thing and put them on another thing. Or is it just a new way to get high on marijuana and other drugs? Because now that everybody's allowed to carry these around, you actually don't know for sure what your patient is vaping when they walk into your office. Like you might hope that they're vaping just nicotine, but they might be dripping, dabbing, dipping, whatever the word is, with something else in that little machine. So I guess unless you have a really good nose and you can sort of smell the marijuana from a mile away, you wouldn't really know. And so it just is a way to carry your drugs more surreptitiously around with you, I suppose. So I'm going to stop there, just sort of leave a little tiny bit of a cliffhanger and see what you guys think about this whole e-cigarette phenomenon. Clearly, it has taken over. It's slowed down a little bit, but at the time in 2018, 2019, it had taken over the country. Now I think the feds have got a hold of it and are going to pass a whole bunch of rules, which will make it harder and harder to sell. So, anywho, let me stop sharing and take some of